Hey, Dr. Conroy here. I am going to be going over eligibility for the FAA's fast track process. So I apologize for looking down at my notes, but there's a fair amount of detail about this. I want to make sure I don't miss anything. So essentially, this fast track process, right? It offers a streamlined process if you're eligible. It kind of avoids the time and expense associated with the standard track. So you have to meet certain criteria. There's a fair amount of paperwork documentation that needs to be submitted and reviewed, and then there's a clinical interview, but we'll get to that in just a couple of minutes. So now the eligibility for fast track, primarily no ADHD symptoms and no ADHD treatment over the past 4 years. So that's either one of those. You know, there are people who, for whatever reason, may not be formally diagnosed with ADHD, but they took some form of psychostimulant medication, what would be considered ADHD treatment. And if that's occurred within the last 4 years, it's an automatic kick over to the standard track. Now, when we're talking about no symptoms, right? We'll talk about how we're going to document some of that. But so we're talking about the absence of symptoms and no treatment over the last 4 years. The other thing is there can't be any instability in academic, occupational, social functioning. We determine some of that through clinical interviews, some of that through the record review, but that's another critical component of this. And the other thing is no other psychiatric diagnosis. So that's just not the last 4 years. That's kind of historically. So if there's any history of anxiety, depression, other significant psychiatric diagnoses, that kicks you over to the standard track process. Now, once again, moving to that standard track process doesn't mean you're not going to get your medical. It's just a more involved process. Okay. Now, whether or not you're eligible for fast track or standard track related to ADHD, there is a fair amount of documentation that you need to track down. So there is a document called the FAA's document called the ADHD Document Checklist. It's a PDF. You can obtain that from the FAA. You can obtain it from your AME. You can always give me a call or send me a text or an email, and I'll get you a copy of that sent out as well. Now, the documents you need to obtain, you're going to see this on the checklist, but let me just review them, right? You're going to have to get your pharmacy records, which are fairly easy to get. You're going to get those for the last 4 years. You're going to have your medical records related to ADHD diagnosis and treatment. Educational records. Now, lots of times people will say, you know, Doc, you got to be kidding me. I got to get my elementary school records. Yeah, you do. So basically, you want to get all of your educational records. So going back elementary, high school, grade reports, you know, higher education, trade schools, programs, things like that. If you had an individualized educational program or a 504 plan, you want to get those documents as well and submit them. You want to get your driver's record. So for any state where you've had a license over the last 4 years, you want to get that driving record. You're also going to have to submit a personal statement. Now, it is referred to as the ADHD personal statement. There is a rubric for that. Once again, you can get that from the FAA, but I can get that to you as well. That it's what I typically recommend. Just get that rubric and you want to answer those questions. Other thing about the records is as you're going through there, if for any of those, if you are not able to obtain the records just because they're not available anymore, right? You may have had ADHD diagnosis and treatment when you were younger and maybe that individual's not in practice anymore, you can't track them down. That's not a deal breaker, but what you want to do is you want to document your efforts at obtaining those records. Okay, so whether that you get a note back indicating the records are no longer available, or you can't find the individual, you just want to document those efforts. So you just don't want to have this omission in the requested records. You want to indicate why they weren't available. Okay. Now, the neuropsychologist or the AME may request records above and beyond those ones that are on the checklist to determine your eligibility, and that's at their discretion if they ask for those. The other thing is the neuropsychologist may have you sign a consent, and likely will have you sign a consent allowing contacts with other individuals who can kind of talk about your status. So that might be parents or teachers or flight instructors or coworkers, anyone who can talk about your functional status and history a little bit. Other thing, all the records you are going to, so on the fast track process, as the neuropsychologist, you are going to send those records to me, and I need to have all of those before we have the other component of this, which is a clinical interview. So the other thing I recommend is if you get those to me digitally, that's great. You want to keep a copy on your own, because at some point you're going to want to, depending on where you're at in the process, which process you do, you're going to be likely bringing that packet of records to the AME as well. One last thing about records: if you already have a medical certification, or you've already had records that have been submitted to the FAA, you essentially then at that point have an airman record, and that airman record needs to be sent to the neuropsychologist. So there is a form. You may have seen it. It's called the Request for Airman Record. It's Form 8065-2. You can download that from the FAA's website. I can send you a copy as well. The neuropsychologist is going to be listed as the third-party recipient of your airman record, and it can take a little while for those records to get generated. So you want to get on top of that as soon as you can, because it's not uncommon for that to be the holdup in terms of being able to schedule that interview. So to move on, after all those records are obtained, if it looks like, based on the record review, it looks like you're eligible for the fast track process, we would schedule a time for kind of an expanded clinical interview. Now, that can be in the office. It is actually the only time the FAA allows telehealth. Everything else needs to be in person throughout any of the other FAA processes around MedCert. But the clinical interview for fast track, that can be done via telehealth. Now, in my case, I would review all your records, and that interview is for me reviewing, asking questions to get a little more detail about some of the things that are in your records, as well as a little more detail about your day-to-day functional status related to issues of attention and executive functioning, and a lot of those academic, social, and occupational things we referenced before. So, as a result of the record review and a clinical interview, if the neuropsychologist determines that you're eligible for the fast track process, the neuropsychologist will generate a narrative report. There's a FAA summary form that is completed. Both of those things will be given to you. You will bring those to your AME for your medical exam, and if the AMA deems it appropriate, they can give you your medical certification at that time. As I said, if it was determined that you're fast track eligible. Okay. So what are the benefits of this process? As you can imagine, right, I think they're pretty evident. If you don't know, the standard track process requires a fair amount of neurocognitive and other testing. It's pretty much an all-day proposition. So it is more time intensive, it's more labor intensive on the part of the neuropsychologist, and obviously there's more of an expense because of those other components of the evaluation. Um, Now, a couple of things to remember. As I said, you want to track down all the records you possibly can. The other thing you want to do is you really want to be, in all your documentation, you want to be accurate and truthful in the information that you submit. If anything that's determined kind of inconsistent or misleading, it can result in not only a delay, but it could result in a denial of med certification. So you want to submit everything you can and make sure it's as accurate as you can possibly submit it. Once again, tracking down these records can take a while. So if you're getting started in the process, you want to get those requests out as soon as possible. And once again, if you do have an airman record, you want to get that request for airman record to Oklahoma City as soon as you possibly can. Hopefully, this answered some of your questions about the fast track process. If it turns out that if you already know that you're not eligible for fast track based on anything I've said, then you can go over, take a look at the other video on the ADHD standard track process, and that details that process and the testing and the other things that are different from fast track. All right. Thanks a lot for checking out the video, and good luck in the process.